Hello, doctors. Hello, students. Once again, welcome back to our 90 days University Prof Pre-Final Mastery. Today, we are in Systemic Bacteriology 8. Yeah, topic 8. Questions from Systemic Bacteriology, 8 topics. So, what is here today? What we will be discussing is this one. The main question is it's all about Vibrio cholera today. Okay. So, the big question would be again Vibrio cholera. Everything we're going to talk about Vibrio cholera. Definitely an expected, very, very important long or short question. Definitely you'll have. And one more question also, definitely you can have a lot of questions, not just for your pre-prof, also for your NEET exams, INSCT, every exam, FMG exams. Usually you'll get a lot of questions from here. So everything is related to Vibrio cholera only. VR media, your string test, LTOR Vibrio, lab diagnosis again, halophilic Vibrio, cholera, virulent for XXCV. The last one we're going to skip it. This question we may skip it because this is not relevant question. It used to be, now it's not even asked much. If needed, we will talk about it in upcoming classes. Okay. So now next one is, yeah. So you already know about why to choose an Auricle classes. So you have all the recorded classes. Excuse me. So Oracle, because you know that you can see we have all recorded classes, we have live classes, we have practical sessions, exam module, and hard copy sets. Okay, these are the things which are providing in Oracle. So it makes your study very easier and better. So one of its best way to clear your exam without any stress or anything. Okay. So now foundational courses, that's what all this foundation courses here. It's with your flexible learning, expert instructions will be there, and convenient revision will be there. Very important for you people. So live classes also there. You'll be getting in-depth coverage, experienced educators, and interactive learning. And then also, so express exam module will be there. You will be completing syllabus in 20 hours, answer writing skills, and expert educators to guide you. One-to-one doubt clearing session is also there, and hard copy sets will be provided for you. And there's a good question bank, so you have a number of questions which covers all entire microbiology. Not a single thing is left out. 95% of all questions will be there. So you will be checking that also. Okay. So, and the practical sessions are very, very important. Practical sessions we will be showing you directly. Means in the practical session, what you're going to do basically is all the live things, whatever the medias, the biochemicals, everything, whatever possible, those things will show you. That is the exact thing they will be asking you in the practical exam. So it's going to be very, very easy for you. Okay. Yeah. So these are subscription plans. You can see there's a foundation plan, advanced learning, complete learning, and ultimate MBBS plan. You choose which is convenient for you, better for you, and you can use this code. Yeah, Dr. Santhosh Rajan. This is my name, Santhosh Rajan 20. This is the code for getting discount. Okay. So now what we'll do, we'll go to a question. We'll start our question now. Okay. So it's very simple. Classify the Vibrio, morphology, culture characteristics, and pathogens. So lifelong Vibrio is important. Whether you become medicine or pediatrician or whatever, any field you go, for exam purpose also for your future. Okay. Vibrio is very common disease. We have in Vibrio infection. These days, very commonly we're getting Vibrio infection. So let's start. First of all, they told about Vibrio directly. There's no classification. So better we'll classify first and then we go. Okay. So when we talk about classification, the simple classification. So how we classify? First, we put into the serogroup. Okay, serogroup. Then we will be putting the biotypes. Under serogroup, you will be having biotypes. And then comes your serotypes also. Okay, three things. That's what Vibrio classification. You never see this classification except your streptococcus. They would ask you classification, alpha, beta, gamma, hemolysis, and you classify it. But other one important is Vibrio because they have this type of serogroup, biotypes, and serotypes. Okay, so first one is a group, then types. So serogroup basically we classify them into like this. How you classify? You can do O1 group and O139. O139 is basically called as non-O1 group. Okay, so it is basically O139 serogroup. Okay, this is just for epidemiological purpose. So just you have to know only. That's it. Okay, and what are biotypes? In biotypes, again, this O1 will be having two things. What are they? They are basically the classical and LTOR, classical and LTOR. Okay, we are going to talk that also. We are going to differentiate it very easily. Okay, and serotype. In serotype, we know that classic 3-1, that is Ogawa, Inaba, Hikojima. Hikojima. Okay. These are the three things. Ogawa, Inaba, Hikojima should be in your fingertips. It automatically will come. Okay. Now the classical and L-TOR. When we talk about the classical and L-TOR, this is one thing which is very, very important for objective question also. And you have one short note also on this. Okay. Classical and L-TOR classification. So how to classify this? So let's classify like this. So first of all, classic and L-TOR. So biotypes, how to classify? Very simple to differentiate these two. Again, for epidemiological purpose only, not diagnosis doesn't make any significance for us. Okay, so how do you do? How do you classify it? First of all, classic type, remember the classic type, it is phage susceptible, also polymyxin sensitive. Right? 2 pp will come here. That's it. Okay. But for L-TOR is something, this L-TOR guy, he likes all non-vegetarian things. Okay. Let's remember like this. Vibrio, you remember as a Viba. Viba is a girl, right? She's a girl. Vibrio. Viba's boyfriend, remember Viba's boyfriend is L-TOR. Okay. Remember L-TOR, Altor, it sounds very similar. This guy likes a lot of non-veg. What all he likes? So let's write like this. He likes veg paratha. Okay, remember like this. He likes veg paratha number one. He likes what? He likes chicken. He likes chicken very much, like all of us. And then also he likes what? Sheep meat, right? These three things. Okay. So now, why I said all these things? Because in LTOR, what you do is that you see this VP Vox-Pushkar reaction. And fourth one, he likes to go camping also. He loves to do camping. This is a shortcut I'm giving you. When you're writing here, you're going to write VP reaction positive veg paratha, but it's not veg paratha. It is Vox-Pushkar's reaction. Okay, one positive. Second one is your chicken. Chicken, you're going to write it chicken RBC. You have chicken RBC agglutination positive. RBC agglutination positive. Okay. And sheep because you in sheep blood agar you will see hemolysis positive. Okay, you will see beta hemolysis positive. And third one, camp test. Camp test you must have studied. We have studied camp test positive in your group agalactia. We haven't come yet, it will coming. Streptococcus agalactia, we studied that there's a camp test positive. Okay, that is basically group B streptococcus. So same way here also it's camp positive, remember. Okay, so these things are positive for LTOR, which is negative for classic. So if you have come for short question, it comes, you can answer. Also, one more question, you can answer it. Okay, we're done with this. Now we're going to morphology. Okay, in morphology, very important actually. Vibrio morphology is very, very important because Vibha is a slim girl. Okay. I remember Vibrio, remember like Vibha, she is a slim, trim, fit girl. Okay. She's slim, fit. Okay. She's like very slim. That's what I mean. Why becomes slim? So she's actually, she looks like a comma only. She's super thin that she looks like a comma. Okay. Okay. So now what I want to say, morphology, this is again gram negative, it's a gram negative bacilli, right? And which is comma shaped. The idea is it's comma shaped bacilli. This is when you have to mark it, you have to write it. And one important thing, we call Viva, because she's very slim, fit, and beautiful. We call her as a darling. Okay, remember as a darling girl. She's a darling. The idea of darling is simply to say it has darting motility. Very, very important in morphology. You have to write this point. Okay, one more question repeated many 100 times. They have asked this question: darting motility. Darting motility, or otherwise, it's also called as shooting star, right? Shooting star. Shooting star means you can't trace the path of this Vibrio cholera. Okay, right? So darting motility, gram negative bacilli comma shaped and darting motility. These are the two morphology characteristic feature. Then now about the culture characteristics. When you talk about the culture before going to culture characteristics, we'll say pathogenesis and go in order. Okay, here they've given everything together. We'll go to the pathogenesis. Now, when you talk about the pathogenesis and clinical future, right? Pathogenesis and clinical future. You must already known, but again, let's take a revision for us now. So what is important here? First of all, what is the infective dose? You should know infective dose of different bacteria. Example, if you remember in Salmonella, we studied, we need to have 10 power 3 to 10 to the power 6 bacilli per ml of any, the food, I mean, say water, food, whatever drink, you should have minimum 10 power 3. For Shigella, it should be 10 to 100. But for Vibrio cholera, it's very, very high. You need to have more than 10 to the power 6 ml of bacilli per ml. 6 ml, 10 power 6 ml, 10 power 6 bacilli per ml of whatever fecal oral route. So it should be anything, okay, in the food. So this much bacteria is needed to cause an infection. That means what are the risk factors? So risk factor means something related to stomach. There should be some problem with your stomach. Okay, that's frequently asked question. So simply you call it as achlorhydria. Achlorhydria means when there is decreased HCl production in stomach, right? So this condition will happen when achlorhydria condition, commonly it happens when you are taking people on proton pump inhibitor or people when they are taking any, syrup, like syrup like gelisul or what, antacids. Basically, you can say antacids. Also, when you have a gastrectomy. So these are the risk factors that increases the chance of this thing. So that means your route of transmission is ROT. Route of transmission is fecal-oral route. Yeah, fecal-oral route, usually water. Fecal-oral route, you know this very well. Okay, so this is the pathogenesis. Now, pathogen starting. So this is the basic thing. Now, continuing this part, what is happening? So now, when the bacteria enter, the mechanism, what type of mechanism it has? Now, when your Vibrio enters into it goes to GIT, right? When it goes to GIT, you know that what is its favorite receptor? That is GM1 ganglioside receptor, GM receptor. You can say GM receptor, GM1 or GM receptor. Okay, GM receptor. It goes and attached to the GM ganglioside receptor. And after attaching this receptor to which mechanism? Cyclic AMP mechanism. This is we frequently told. Cyclic AMP mechanism. So this mechanism will undergo and cause what? The water from in the intestine wall, the water will come out. There is some exchange salt and water. So this will lead to what? Watery diarrhea. That is basically non-inflammatory diarrhea. Remember, non-inflammatory diarrhea. You will not have any inflammation Vibrio. This is one of the very important question. You just like your enterotoxigenic E. coli. ETEC also same. This also same. Non-inflammatory watery diarrhea. Okay, watery diarrhea. Also, it's also called as what? Rice water diarrhea. So all are one mark question. That's what I'm saying. In diarrhea, it's all anywhere they can ask question from you. They can expect question from you. Okay. Water diarrhea, non-prepared rice water diarrhea. That's it. Okay. Mechanism is this. GM receptor, cyclic AMP mechanism. Cyclic AMP basic, that means you go to adenylate cyclase pathway and then cause your water not to come out into the lumen, and water will come out as a non-inflammatory severe diarrhea. So that's what patient usually what happen. Patient with this will have, if not treated early, he will undergo shock. He will undergo shock. Severe dehydration, and patient may go into shock. So that is the clinical feature. This is the mechanism of diagnosis. This is the basic pathogenesis and the clinical feature of your Vibrio cholera. This much only. Okay, nothing to explain. Everything is one mark question, and every point examiners will expect you. Rest you can write your story. Nothing is wrong in it. Okay. Yes. So this is a mechanism. Now next part will be a diagnosis. Yeah. So now diagnosis part. How to lab diagnosis? So the sample is stool. You take the stool sample. So you get this watery stool will be there. Stool will be given to you. So now first one, what you're going to do, you can do the first hanging drop method. In hanging drop is a very important method, because in hanging drop method or wet mount, what you will see, basically hanging drop is much better. You will see darting motility. Darting motility also seen Campylobacter jejuni. But yeah, you remember here it's very important. Darting motility or shooting star motility of the bacilli you can see, number one. Okay. Number two, you're going to do gram stain. Gram stain, of course, very less. You see not that much characteristic, but still you can see a comma shape or spiral shaped bacilli. Right. Next is your, now important is your culture characteristic. That's what they have stressed on that question. Culture characteristics. So you have different type of culture medias. All are important, right? So first one is, because when the stool is coming, we have to enrich it, right? So you're going to do enrichment. No, before enrichment, we'll talk about the transport medias. Okay, that's very important. So for transport media, For Vibha, Vibrio Cholera Transport Media. Vibha is a rich girl, so she has a driver to drive for her. What is driver's name? VR. That is Venkat Ramanan Ramakrishnan. Venkat Ramanan Ramakrishnan. Indian name, right? Ramakrishnan Media. So he is this found this media, special media. Also, she likes to carry while transporting. She likes to carry back. So carry Blair. Okay, carry Blair. And her favorite water while transport is autoclaved seawater. She doesn't take mineral water. She take autoclaved seawater because they are halophilic, no? All Vibrio salt loving. So seawater, okay? So Vibrio cholera, carry Blair media, autoclave. We are carry Blair. These are the transport media. Expected 1 mark question. If you write this is you have to write it to get good score. Okay. So this is transport media. Now, next, we are going to the next media. That is our transport, and comes your enrichment media. Now, after transporting, we have to increase the growth, increase the enrichment. The chance of getting will be more in enrichment media. The growth of that particular organism will be more. So, in enrichment media, what are the things we are going to use? One media that you have to remember, always asked, frequently asked, is alkaline peptone water, because it doesn't like to live in acid, it likes to live in alkaline. If you remember stomach also, because acidity less, that means alkaline media it can grow. So alkaline peptone water, this one very, very important. Mark this enrichment. Okay, so question will be there. Now next one. Next is the selective medias. Now what are the selective medias? Selective media, it grows well. So for selective media, what you have to use is, what are selective medias? You know, the selective medias are like this. First one would be your selective media is TCBS. And other one is your bile salt agar. One is Mansoor's Taurocolate media is there, but these two is more than enough. TCBS and bile salt agar is more than enough to say. Okay, they are the selective medias. TCBS media is basically what it is called. The TCBS media is also called as thiosulfate, citrate, bile salt agar. Okay, bile salt, sucrose agar. This is bile salt agar. This is bile salt agar. That's it. So these are the two selective medias, two important selective medias. Okay. If you want to write, you can write that Mansoor's media also, but examiners will be happy with these two. It's this most commonly assessed these two. Okay, fine. So culture is over. Now, what is next one? Your biochemicals, which is very, very important again here. Biochemical. For biochemical test, we have big list is there. Okay, because this gives a lot of important reaction. First one, oxidase. Oxidase test will be positive. Okay, one. And then what else? After oxidase, we are going to do nitrate test also. Nitrate reduction test, that is nitrate test only. Nitrate test, that is also will be positive. Okay, then one more. We'll have indole. Indole ring you put, that also will become positive. Okay, apart from this, what else? So there are other some important tests also. We're going to talk that. Clear it. Next page. String test. We are going to talk about string test. There's a separate question also in string test. Okay. String test. And cholera red reaction. Cholera red reaction is basically that nitrate plus your indole test. That only. Okay. It's called simply that nitrate test is otherwise called cholera red reaction. String test is basically what happened when you mix the Vibrio colony with bile suspension, you will see a string is coming out. Okay, a string. If you pick the colony, you'll see just a string will be coming out like this. Okay, we'll talk about that. Okay, then cholera red reaction, this methodology. So these are the common biochemical tests we are doing for a Vibrio cholera. Okay, other some serological tests and all we can do, but this is more, these tests are more than enough to identify your Vibrio cholera easily. Okay, that's all. So we're done with our all the top culture category, everything. Okay, so if you have doubt also, we have all the things here. See, all the things are mentioned very clearly here. You can go through it. Okay, if any doubt, all biochemical tests, string test, oxidase, everything, nothing is missed, right? Everything is there. Okay, this is the string test which we are talking here. If you see this picture, This picture, what you're seeing here, this is the string test. This is when you mix with the bile and you try to lift it up, you'll see a string is coming out. Okay. And these are your thiosulfate, TCBS, thiosulfate citrate bile salt agar. Okay, thiosulfate bile salt agar. Okay, so this is this one, exactly this one, and bile salt also somewhat like this only. It will be, except some black color will be there, but it's okay. So these are things common. Okay, thiosulfate bile salt agar. You're going to see everything. Okay, that's all. So clear it. No, VR media. So VR media, it's very, I don't know, it should be a 2 mark question, but you never know, what examiners expect. So if they ask VR media, you're going to write, this is the Venkat Ramanan Ramakrishna media. First you write this first point, and then you're going to write, this is for transport media of, this is transport media for your Vibrio cholera. Okay, transport media. So in this media, what happened? It is only for viability of the bacilli, viability of the Vibrio. No multiplication. No multiplication occurs. Okay, that's all. These are the in fact, any transport media, this will not happen. Okay, only this. So this is the 4 points. If you write, that's more than enough. Okay, so usually you can expect this in a 1 mark question only. Okay, that's all. Nothing else here in VR media. So string test we already spoken, but once again we'll go. String test, what basically you have to say in string test is that you're going to say string test is done for Vibrio cholera. First of all, you're going for Vibrio CHOLERA. We have another string test in parasitology. Okay, that is you put a capsule, you insert into your duodenum, and from there you collect the sample to check that important. The 3 bacteria will come in that one. Okay, and especially we do for Giardia we do, and for also Cryptosporidium and also Strongyloides. We are going to do that one. Okay, that is for another string test. This is for Vibrio cholera bacteria string test. So here what we are going to do is a string test. Here the colony is mixed with 0.5 percentage bile suspension, that is basically taurocolate. Taurocolate is a bile suspension, 0.5% bile suspension. Now with a loop, if you lift it, now with loop, if you lift the suspension, you'll get a string, will be positive. Okay, so the string will come like this. This is the string, so it will come out. So then that means it is your Vibrio cholera. This much only, nothing else. So you can draw a picture like this, and so it's lifting up. Very, very simple and easy. Again, it's a 2 mark question, but usually it's 5 mark. Even 5 mark, if they ask, you can, with the picture, everything you can explain. Nothing is wrong. Okay, that's all. So now, yeah, string test. So everything is mentioned. Alter Vibrio, we just spoke. These are, if we talk about Alter Vibrio, this is one of the biotypes. So we have VP test positive. Going to same thing what we explained. VP positive, CAMP test positive, chick RBC, and hemolysis and shiplet. We just spoke about this everything. Okay, so this is also done. Next, halophilic Vibrio. So in halophilic Vibrio, what you're going to write is halophilic Vibrio means these are the Vibrio which grows in high salt, means 6 to 10 percentage NaCl. Okay, they're going high salt concentration. They can grow in high salt concentration. Means mostly you can see in seawater, right? Sea. Okay, that's it. So what are the things? Halophilic Vibrio. There are 3 things. There are 3 Vibrios which are very important. One is your Vibrio para hemolyticus. You have a lot of clue here. Vibrio para hemolyticus. And second one is your Vibrio vulnificus. Vibrio vulnificus. Okay. And third one is your Vibrio alginoretus. Lyticus. Okay. Now. So Vibrio parahemolyticus, basically what is important, this one, usually it's the seafoods. It is contaminated from the seafood. Seafood means specially crabs, fish, anything, shellfish, anything it can happen from seafood. So that will lead to what? Food poisoning. Food poisoning is very, very catastrophic. Okay. Now, here, Vibrio has a very important one is swarming growth. Swarming, we usually talk about Proteus, not only Proteus, even parahemolyticus also, swarming motility. It has swarming motility. One. Number two, special, we have a special agar called Vagatsumo blood agar. So in Vagatsumo blood agar, what happens is that you will see it's actually blood agar with increased salt concentration. So you will see beta hemolysis, just like the name says here, hemolyticus, you will see beta hemolysis when the salt concentration is increased. That's what they call this as Kanagawa phenomena. Kanagawa phenomena. This question was asked in your recent AIMS exam or NEET PG. They have asked this question. So you have Kanagawa phenomena. Okay, beta hemolysis, Kanagawa phenomena. One important one. Okay, the Vibrio vulnificus. I talk about the Vibrio vulnificus. Same thing. Seafood, food poisoning, but some cases because of this the virulence factor is very high, it can lead to sepsis and sometimes wound infection also. Sepsis and wound infection. Okay, sepsis and wound infection, that's what called vulnificus. Okay, sepsis and wound infection, you're going to write all these things. Okay, right. And Vibrio alginolyticus is the highest salt which can grow even in the, it needs highest salt to grow, highest salt concentration, almost 10% it need, 10% it need. So here what happened, alginolytics basically causes ENT infections, ear, nose, throat infections more, ear infections very high. So that's much. These are the three things. Parahemolyticus, vulnificus, and alginolyticus. You write this and explain, it's more than enough for getting a 5 mark. Okay, that's all. So every explanation is given here. You can go through it. Yeah, all the things are mentioned. Yeah, so that's all. So these are the things. So once again, thank you. So today topic was less questions. It's fine, good. So anything more doubt if you have, you can always contact us and we will help you to clear all your doubts. Okay, that's all for today. Thank you.